What actually happens when you use manual lymphatic drainage? How does it influence swelling, pain, or even enzyme levels after injury? And can a massage technique really improve fluid transport inside the body? I'm Eleftheria, and in this episode of Science Behind Massage podcast, we're exploring what current science says about manual lymphatic drainage and how it applies to lymphedema, inflammation, sports medicine, and rehabilitation. I'll walk you through solid research and physiological processes, and if you have studied massage therapy and anatomy, this will connect the dots between what you do with your hands and what's happening in the tissues. The human lymphatic system is a dense vascular network that returns interstitial fluid, that's lymph, back to the bloodstream. Lymphatic capillaries spread throughout the skin, muscles, and organs collect the excess protein-rich fluid that constantly leaks out of blood capillaries. This fluid travels through progressively larger lymphatic vessels and passes through about 600 lymph nodes, which are clustered in areas like the axilla, groin, and neck to filter out pathogens. All of this drains into the bloodstream through the thoracic duct or right lymphatic duct at the level of the subclavian veins. Lymph movement relies on both intrinsic smooth muscle contractions of the vessels and external forces like breathing, movement, and arterial pulsations. Manual lymphatic drainage uses specialized rhythmic strokes along the skin to follow the flow of lymph, usually beginning at the trunk and neck to clear the central ducts. These strokes stimulate the natural lymphatic pump, improving low-pressure fluid return. Therapists stretch the skin in the direction of lymph flow to open up lymphatic valves and route the fluid centrally. This technique not only boosts intrinsic vessel activity, but also clears interstitial proteins, cytokines, and inflammatory cells from tissues, which leads to less swelling and better tissue balance. In cases of lymphedema, which is chronic swelling caused by failure of lymph transport, this becomes critical. Lymphedema fluid is protein-rich and persistent. It doesn't resolve like ordinary edema and tends to cause tissue fibrosis and higher risk of infections. Manual lymphatic drainage is a cornerstone of therapy here. For example, in cases involving the arm, manual lymphatic drainage often starts with strokes around the chest and clavicular area to clear the terminal drainage points, followed by movements towards the axilla and cervical nodes, helping fluid leave the affected limb. Research backs this up. A 2024 clinical trial showed that when manual lymphatic drainage was left out during the maintenance phase of breast cancer-related lymphedema care, patients had a significant increase in arm volume and reported more pain and heaviness. That alone strongly implies that manual lymphatic drainage is not optional, it's essential to keeping lymphedema under control. A large meta-analysis involving 457 patients showed that although a single standard manual lymphatic drainage protocol doesn't significantly reduce lymph volume, when the therapy was extended, meaning at least 20 sessions over 2 or more weeks, the results become clearly positive. Arm and leg volume dropped and symptoms improved. This tells us something very practical. The amount of manual lymphatic drainage matters. It's not just the technique, but the consistent application over time that brings measurable benefits. Other studies show patient-reported improvements in pain, swelling, and limb function when manual lymphatic drainage is added to rehabilitation. One notable study found that breast cancer survivors who received manual lymphatic drainage developed half as much long-term lymphedema and experienced significantly less arm pain. Therapists regularly observe that tissue softens and tightness decreases right after sessions. Imaging studies such as MRI and lymphoscintigraphy also confirm improved lymph flow after manual lymphatic drainage. Altogether, sustained courses of manual lymphatic drainage can break the cycle of edema and fibrosis and restore near normal comfort and mobility. But the benefits of lymphatic therapy are not limited to lymphedema. Inflammation is another area where manual lymphatic drainage plays a powerful role. When tissue is injured, blood vessels release fluid and immune mediators into the surrounding area. Removing this fluid is essential for resolution. That's the lymphatic system's job, and manual lymphatic drainage supports it by physically moving fluid and inflammatory mediators into the lymphatic vessels. This includes flushing out molecules like bradykinin, histamine, prostaglandins, and immune cells such as neutrophils and macrophages. The result is faster resolution of inflammation and less pain. Manual lymphatic drainage also stimulates the parasympathetic nervous system. That alone helps reduce pain and lower stress, but even more importantly, the technique helps remove lactic acid and other pain-producing chemicals from the tissue. Therapists who use manual lymphatic drainage regularly report significant relief in clients experiencing chronic inflammatory pain or swelling. Now, let's look at the physiology behind this in more detail. First, manual lymphatic drainage increases the drainage of fluid from swollen areas back into the lymphatic vessels and onward to the venous system, protecting blood volume. Second, it clears out proteins from the interstitial space. These proteins are what make lymphedema different from water-based edema. Protein holds onto fluid, so removing it is key to stopping chronic swelling. Third, manual lymphatic drainage improves removal of inflammatory and metabolic waste products, including extracellular creatine kinase, lactate, and cytokines. These molecules contribute to pain and fatigue after injury or overuse. Finally, manual lymphatic drainage may help modulate the immune and nervous system, reducing pain perception and promoting tissue recovery. In sports medicine and rehabilitation, these same principles are applied. A number of clinical studies show that manual lymphatic drainage can reduce swelling, relieve pain, and help restore function more quickly when added to conventional care after injuries like ankle sprains or surgeries. Patients recovering from carpal tunnel or nerve entrapment have shown better nerve function and grip strength when manual lymphatic drainage is included to reduce perineural swelling. Even athletes recovering from intense workouts can benefit. In several well-controlled trials, post-exercise manual lymphatic drainage significantly accelerated the clearance of blood lactate and muscle damage enzymes like LDH, CK, and myoglobin. One study found that applying manual lymphatic drainage immediately after treadmill exercise led to a much faster drop in these markers compared to no treatment. Another study targeting forearm fatigue showed that manual lymphatic drainage not only lowered muscle lactate but also helped athletes recover strength faster. A 2021 study using a lymphatic pedal pump technique found lower blood lactate just 20 minutes after maximal effort compared to passive rest. The mechanism is consistent. By boosting venous and lymphatic return, manual lymphatic drainage supports more efficient metabolic recovery. Athletes and therapists alike report less soreness, lower muscle tension, and better range of motion when manual lymphatic drainage is part of post-workout care. So, how can you, as a therapist, apply this knowledge? In lymphedema cases or chronic inflammation, use manual lymphatic drainage early and consistently. Research supports multi-week programs for long-term improvement. After injury or exercise, apply manual lymphatic drainage or lymphatic pump methods promptly to assist in clearing fluids and accelerating recovery. Your anatomical understanding is vital. Manual lymphatic drainage must be routed towards major node groups like the axilla and inguinal regions, and work must begin proximally to open central drainage pathways before treating distal areas. There are still exciting questions ahead. How much manual lymphatic drainage is ideal for different conditions? Current studies suggest at least 20 sessions are needed for sustained effects in cancer-related lymphedema, but we don't know yet the optimal dose for other chronic or acute inflammatory conditions. Does age or general fitness affect outcomes? One study noted bigger improvements in patients under 60. Could we one day track biological markers like cytokines or growth factors to assess manual lymphatic drainage effects? And what about complex conditions like fibromyalgia, where low-grade inflammation and autonomic imbalance are involved? Early reports are very promising, but larger studies will clarify the protocols. What's clear is this: manual lymphatic drainage is not a passive secondary technique. It is an active method that produces measurable effects across multiple systems, reducing fluid overload, improving enzyme clearance, shortening inflammation, and helping people feel and function better. Integrating manual lymphatic drainage into treatment can help your clients recover more quickly, reduce pain more effectively, and return to movement and quality of life with less resistance. If this kind of content helps you think more deeply about what you do with your hands and how the body responds, subscribe to my channel for more massage therapy education. And if you'd like to explore further, check out my massage therapy books on Amazon. You will find me there as Eleftheria Manjoru. Hey, be always healthy and happy. Thank you for hearing.